and above all, recharge your energies so that we can continue with our second half of panel sessions, which is going to begin right now. This one is called, well, More Effective Responses to Health and Environmental Emergencies Through Peace Building. Allow me to introduce you to our next set of panelists. We have Wahid Majroh, former Minister for Public Health in Afghanistan. We have Elhaj Si, former Secretary General, IFRC. We have Michaela Serafini from ICRC. And we have Dominic Bourgeon from FAO Liaison Office at UN Geneva. Of course, we couldn't have this discussion without our moderator, René Larivière from Interpeace. Now, René, as a moderator, your job will be, of course, crucial to liven up this conversation, as well as being a timekeeper so that we make sure we end up at exactly 3 p.m. so we can continue with our next session. Enjoy.
Great, thank you, Ariane, and thank you for introducing the panel as well. Welcome, everyone, and welcome to the participants online. First, a brief word of thank you to the Geneva Health Forum as well for allowing this discussion to take place. I know it's a bit of an unusual discussion to be talking about peace, health, conflict, humanitarian affairs, all in one conversation, but it's also very timely as well. So before we get started with our speakers, let me frame the conversation for you. As a peace builder, but also as a former environmental expert, I've seen the growing convergence over the years of how climate change, how climate emergencies and conflict are very much widely discussed and observed also in different countries. We have, however, very limited understanding of the intersection between health, between peace, and between conflict. So today, what we'd like to do with you during our 1 hour conversation is very much explore how conflict intersects with climate change issues, but also health emergencies. And we want to share maybe some lessons learned and how we can be better prepared for tackling these challenges in the coming future. We just have to look at the 2014 Ebola outbreak in West Africa or the 2018 Ebola outbreak in DRC to illustrate how the humanitarian sector, but also how the environment and also the peace-building community were all of a sudden operating under the same area. And we saw that this is no longer about whose space this is. This is very much about converging spaces, also improving the way that we work and collaborate with one another. So perhaps maybe as one point that's very important for the audience here today, because this is the Geneva Health Forum after all, maybe let me assure you that this is not about changing the work or the core business of the health workers, nor is it about changing the core mandate of humanitarian action. It's far from that. This is really about the long-term footprint that health interventions can have, whether it was planned that way or not, on conflict dynamics in different countries. So this, there's tons of experiences and examples that I could cite as well. At Interpeace, we call this being peace responsive, which is really about thinking a little bit more deliberately on how, if you have an intervention or a plan or a project that's development focused, like building a road, or in the humanitarian sector or health sector about animal vaccination, it's thinking of how you can actually make a positive contribution to peace and maybe not add to the tensions in fragile settings. So this is what the conversation is about today. If you're not convinced, let me just give you a small indicator about the urgency of this conversation or the need to have this conversation today. 50% of the countries that are most at risk of climate change or climate emergencies are located in political or peacekeeping missions. So that is very telling in regard to the timeliness of this conversation. But enough about the setting of this conversation. Let me turn to our speakers. And before we go into a discussion about institutions or system, we have a unique opportunity to hear firsthand experience of how these various sectors intersect in a given time, especially in a conflict setting. And so I'd like to turn to Minister Majerot to help set the stage on how you've lived, how you saw, how you experienced the impact of conflict on the health system or on environmental degradation in Afghanistan. So over to you, Minister.
I thank you. I will present you our experience, our practical memories in the context of a story rather than the fancy words from public health books and the development approaches that we have practiced at least during 2 decades in a context like Afghanistan. I'm sure it is relevant to other parts of the world, which unfortunately these days we have a lot of similarities. Ukraine could be an example. Just in short, unfortunately, conflict is a bad thing. It affects, it has negative impacts on different aspects of our life and a multidimensional impact when it comes to the health sector and health of communities. If you look at that from a public health expert, from a technical perspective, the indicators are badly affected, unfortunately, when it comes to maternal mortality, to child mortality, to people's access to health services as their basic right, to the capacity of the system to deliver services and meet the needs. The damage it poses to the epidemiological transition and demographic transition of society, the NCD, the immunization programs, different aspects of the continuum of care is unfortunately badly affected. On the other side, when you look, it poses the health sector to an assessment by the society and by politicians. In a context like Afghanistan, which I practically felt it, there are times in the peak of conflict where the health sector, the heroes of the health sector, health personnel, remains the only signs of legitimacy of the government, remains the only points of service delivery to those communities that are direly in need of support. And at that point, it is the community, the media, the international partners, and the politicians who all focus their eyes and their lenses at the health sector. It exposes you to a very, very difficult and critical assessment. It raises the expectation. I remember the days before the fall of regime in Afghanistan, where the fight was, the unprecedented fight was going on in 34 provinces of Afghanistan simultaneously. And the white-gown heroes of Afghan health sector, as an example, which is replicated in other parts of the world as well, were the only service providers at midnights in the middle of the battlefields, and the resiliency of the health system, which was a result of a joint collaboration of the Afghans and its international partners, could sustain service delivery in 97.5%, 4% of health facilities in those hard days and nights. That not only just posed a threat, but an opportunity for the healthcare personnel in the sector to fulfill the needs of a society. That is one part. On the other side, the burden, which the expectation, which the conflict puts on the shoulder of the health sector, is completely incomparable with the resources provided to the health sector. Unfortunately, when it comes to the government, to politicians, to Ministry of Finance, and to our international donors, the focus is only on the outputs. And this is what they measure. They never hear the real voices in the needs of healthcare personnel, their thoughts, their requirements, and their drive, their enthusiasm to fulfill the needs of people whom are looking at them as the angels of, to rescue them from the disaster they've been facing with. Using this platform, I first applaud and appreciate the bravery of healthcare personnel in my country, in Ukraine, and in different parts of this globe. They are the real heroes of today. They are the real angels who rescue lives. And I call on decision makers at the global level to listen to this sector, to ensure you provide the means for the ends you expect from them. The health sector across the globe, and in my context, proved it is resiliency, it is passion, it is drive, and it is capacity to sustain and maintain service delivery in the face of conflict, but it needs further attention. And it has proven, and there are examples, practical examples, that if we want to put an end to conflict, to ensure social engagement, social peace, instead of political peace, the health sector in the health system, in health personnel, is the best entry point. It does not only heal the physical ulcers, injuries, but it connects people's hearts. It connects values. It exemplifies servant leadership. It provides people with sincere service, irrespective of which tribe, which village, which party he or she comes from. There are examples where we have enemies coming to our health facilities. But my order, my message to my personnel, in the practice that the healthcare personnel of Afghan system as part of the global health system exemplified, is the neutrality, impartiality is not only our motto, but what we stick to when we practice in the emergency and operating rooms. This is the value we stand by. This is what medical and health systems mean. In these systems, which has proven it is resiliency toward conflict, has proven it is usefulness in bridging peace, in helping peace initiatives to cultivate the values that political leaders have been talking about it for decades, but have failed to practice it into action. Our healthcare system personnel across the globe has exemplified it. Let these leaders, unknown, unrecognized leaders, to lead the peace process as well. They're able to connect with people's hearts. They're able to respect people, to help people without any expectation from them. This is what we have experienced in Afghanistan, and I'm sure that colleagues here and those just watching this program has several examples across the globe just right now where nurses, midwives, surgeons, physicians are providing services in a way that results in enduring peace, not the political peace where the political leaders talk about it, and my Afghanistan of today is a victim of that. I thank you.
Thank you, Minister, for these vivid remarks. I know I was asking you the impossible, trying to summarize your lived experience in a few minutes, but I think you've painted a very vivid picture of the heroic efforts of the medical sector, and also the resilience of the health system, but also at the same time the extreme fragility that it could have had it not been resilient enough to sustain the deployment of services to the Afghan population. Now let me turn to our next speaker, Michaela. You come from ICRC, you're the head of the health unit, you have a ton of experience coming from the humanitarian and development sector. What do you see are the current challenges to the system? We just heard some pretty vivid examples from the minister. What do you think is currently being done to address these challenges? Is it enough? What do we need to do more of?
Thank you, Renee. Thanks for the invitation. Thanks again. Interpeace came to the ICRC to prepare this session, and I think that that is a good gesture in terms of how serious this talk is today, and how the challenges today are going to be the challenges of tomorrow, and we need to, one way or the other, put them in front of us and try to overcome them. When it comes to the aid sector, the international aid sector, I think that, and you mentioned it, Renee, and the mentions of other factors were factored in already. But I think, again, when it comes to the big challenges, DRC, Ebola was one of the latest, where we saw a big number of international organizations coming in, including the ICRC. And we did see that even though there was an emergency, even though time was pressing, even though there was a disease that was having very little consequences, each of us went inside there without necessarily understanding well the context, even though we did know well how to respond to that specific need. And there is where I think one of the challenges comes in, is how much do we understand the context in which we are trying to act. And there is where the conflict sensitivity analysis is a very important component that we need to remember every time that we're trying to tackle a certain need in a certain context. That context sensitivity analysis, obviously when it comes to the ICRC, taking into account that we work in conflict settings and other forms of violence, are added in terms of the complexity of the conflict, the different actors that are coming in, the actors that were there, how in that specific sector health is interpreted, which are the other determinants of health, social determinants of health that are influencing certain seeking behaviors in that specific community. And even though this was an emergency and time was really pressing to contain a very deadly outbreak, sometimes we need to have the time to get the context right so as to be able to answer much quicker. If not, and as it happened in DRC, we are going to be all there, we're going to be all timely there, but obviously the containing that outbreak will take us much longer because we were not sensitive enough to that specific context that might have excluded a population or might have, one way or the other, forgot essential things that needed to be put in place in the first times of the interventions. Another aspect, apart from things that were mentioned already when it comes to international aid coming in, each of us where we have a different expertise, and the idea of combining that expertise to come with a response that makes sense to the community we are in. I think that today, and especially in this Geneva Health Forum, where environment is coming in very big, when climate change is affecting the way we work today, having really this lens in our programs, incorporating this lens of the climate risk and how do you factor it in the response is extremely important. Is extremely important during emergencies. How do you factor in climate risks in your health response? But obviously, it's also essential when you are constructing or when you're supporting a system to become resilient to those climate events that can overturn whatever the investment in health you wanted or you were able to do. We do know that our presence always has an impact beyond the delivery of services we provide. And there we have a responsibility. We have a responsibility to ensure that we are not exacerbating tensions between groups. And that, again, is factoring in the context and taking into account also today, more than ever, the climate risks we are confronted to. Last but not least, there's a consciousness of each organization and its footprint when it comes to climate. And there is where we need to be extremely cautious and trying to understand what is it that we left or what is it that we leave behind once the emergency has finished. And there is how conscious are we of our own footprint and taking care very much on trying to minimize that specific footprint. What needs to, again, coming back to much more coordination, much more complementarity. We are organizations that have our own mandates. No one is asking, I think, Renee, you alluded to that. No one is asking to change our mandate. But I think that the population we're trying to serve is asking us to really look into those mandates and try to complement them so as to have a robust answer for their benefit. Looking a little bit about on my notes, I think, again, apart from the need of coordination, I think is the need of sustaining certain programs over time so as not to become a one-shot approach, but really make them and construct them over the system and not in parallel of systems. Voila, so I'll stop here and continue.
Thanks, Michaela, for sharing your experience and also highlighting the challenges that were found also in the latest Ebola outbreak in DRC in 2018. And also just, I quite like the point that you made about, ICRC is maybe not the conflict analysis expert, but that there is a recognition that you need to reach out to other actors to understand more the context, those others who are working in the context and do this on a daily basis, so that then you're not exacerbating the possible tensions between different communities. So thanks for that. If I may turn to you, Asi, now. You have a vast experience as well in the humanitarian sector. You are the former Secretary General of IFRC. You also have a lot of experience coming from UNICEF. You've taken a bit of a step back from these functions now. What do you think is already done sufficiently by the international system to address some of the challenges that Michaela was just highlighting? And looking back, is there anything that you think we should be doing differently to encourage these types of collaborations that Michaela was highlighting just a minute ago?
Thank you. Thank you very much. Let me, first of all, build on the values and the principles that the Honorable Minister White was referring to. And those values and principles are very important. So he talked about the principles of impartiality and neutrality, and I'm sure Michaela could build on that because these are fundamental principles of humanitarian action. But if we go back to the principles, we can also go back to the principles outlined in the Constitution of WHO, where health is defined as and I stress, complete physical, mental, and social well-being. And it is not only the absence of disease or the absence of infirmity, but that complete state of well-being. Well, if you would like to define peace, in a different way, I think you will not be very far away of a complete state of well-being. Mm-hmm. Now, when in most of the cultures and in many languages, that we speak, we greet each other by saying, Assalamu alaikum, shalom, peace be upon you, la paix soit avec toi, whichever way we turn it out. And then the next question is, and how are you? Not and how you feel. And most of the time, we want to realize, what is the state of your health, in your body, the state of your health, in your mind. And it just shows, the centrality and the connection between peace, and health, as far as, the complete state of well-being of human beings, are concerned. But the principles in WHO went further and says the health of people is fundamental to the attainment of peace and security. I mean, they say that more than 75 years ago. Well, are we forgetting, or are we not realizing that there were very wise, women and men before us, many years ago, coming out of the rubbles, of the Second World War, defining what health is and then what health and peace, is about. What have we done since then? What have we taken forward, or not? I think today we live at a time when there's a lot of advances in technology, a lot of advances in knowledge, a lot of advances in research and development that equip us more than ever before on how to respond, to health challenges. And then if we put it in the context of peace and an environment, then let's remind ourselves of a number of issues. One, there is no emergency situation, no humanitarian situation that you have to respond to and health is not a component of. It doesn't exist. If you have to intervene in any of those settings, your principal aim is to save lives and to alleviate human suffering. So health is a component. What we're seeing now on top of it is now health is becoming on top of it an emergency of its own. Now we talk about Ebola, we can talk about Zika, we talk about all the nasty ones, but so far has been geographically confined. Nipah, Lassa fever, Nile fever, Marburg fever, you name it. They continue, to exist. But if you take the map of those outbreaks, and then you take a map of deforestation, and then you superpose a map of conflict, well, there are great chances, that they, match, in many ways, or the differences, will be very little. And that brings us back, to what does it mean, really, how do we translate the complete state of well-being? And we have to remind ourselves, humans, that we are not the only beings, on this planet. There's an environment, where also we have a fauna, that, we need to take into account. We have a flora that we need to take into account. But if you take the combination of environmental degradation, demographic pressure, we're starting already creating the conditions for conflict because we are fighting over resources, no longer about, diamonds and golds, but, simple things, like access to water, and then the livelihood, and then livestock, of people that have to be, reminding. So having that comprehensive understanding and approach at the beginning is very important. What have we done so far? So far, we've been relatively good in reacting, in terms of response. And when we react, we get into what we call this cycle of panic and neglect. Something happened, we go in very quickly, we do our best, we think we contain it, we go back, and then we sit down until the next time around, the shock and hazard comes, to come. That is the neglect part. The continuum of preparedness, early alert, early warning, early action, and when we act, do we stay there and then build the resilience that we require so that when the next shock comes around, we have the ability to withstand it, that we have not done well. And we need to do better than that, to do much better. So health and peace, come together also in a way that it is about building trust, it is about building respect, it's about building social cohesion, all of them. And you cannot build trust, in the middle of a conflict. It is very difficult to build trust, in the middle of an Ebola outbreak or a COVID-19 outbreak. To engage and then be there before and be there during and be there after is critically important. And it is not about flying in and out. And I think here again, we all here, have to be very humble. It doesn't matter how quick we get into an outbreak, how quick we get into a conflict zone. We always find there people who already are reacting or already coping. And we should never forget that. Well, those who like reggae music will then remember the song that says, Christopher Colombo is a liar. He came to Jamaica and says he discovered it, but he found my grandfather there. So we come to some places, we forget, there were people there reacting and responding. This is often the poorest of the poor who's taking the last cloth to wrap the new baby born. There is a pure, the poorest of the poor who share the last grain, they have, to feed, those who need. They're the ones also who try to soothe, the fever or just, give a hand, that people can lean on, while we didn't arrive. And all of that is about building social cohesion. It's all about, building peace. It's about also strengthening health in the widest, sense, of the word. How can we build on that? To bring, the upstream principles that are very pertinent to the community approaches, that are right there, and then use that as a basis, for the resilience building, the trust building, and then the peace building. That I think is a journey that we all are traveling, with a lot of hiccups, along the way, successes here and there, lessons we learn, but then we have not been very good in building on our lessons and sustaining them and moving forward. And maybe the way forward should be, how can we engage on that journey continuously, in a continuum from preparedness, to resilience building and building the necessary partnerships from the community level all the way, to the international global level, and then nurture, cultivate, those partnerships, in a constant manner, I think would be something we will all need to improve on, and it could be a direction that we could travel together.
Thank you, Asi. I knew I had an all-star lineup for this panel, but you've just proven that all of you have profound experiences to share, and I'm really grateful for you, Asi, reminding us of these important reflections of what's the starting point, right? It is the values and the principles and the complete well-being. It's not just one part. If you have an infection, it's going to eventually affect the rest of your body as well. So it's just simple comparison to also remember that yes, we work in complex environment, but we do need to make greater efforts out of a more systems thinking in the way that we act and we behave and we operate in the field as well. So perhaps, actually, you've provided me with a really great transition for our next speaker, building on the complete package, if I can put it this way, if I may turn to Dominique now of FAO. Now, Interpeace and FAO, Dominique, have a partnership where we're actively working together side by side in very fragile contexts, and where we do see the interconnectedness between animal welfare, human nutrition, and also environmental degradation. They're very much at the forefront of our efforts. And I'd like to hear about your efforts and why is it so important, this link between animal welfare, health, nutrition, and also the environment, especially in a conflict setting.
Well, thank you very much, René, and very happy to be here. And of course, thank you to Interpeace. You started by saying that we are not used in that sort of setting to have the link between peace and health being discussed. I think even less so when it comes to the link between peace, animal health, environmental health, and human health. And yet, it is more and more difficult today to discuss, I would say, health in general without looking at these complex linkages, relations between human health, animal health, and environmental health. And this is why now we have this very much accepted concept of indeed the One Health approach. And as a matter of fact, when you look at the numbers, over 60%, as you all know, of new human diseases have their origin in animals. More than 70% of those coming from wild animals. And yes, there has been discussion on the probable animal origin of COVID, but we are currently living with avian influenza. There was a reference made to Nipah virus, Rift Valley fever, brucellosis. These are all zoonoses that have a very big impact on people, livestock, and on people health. And yet, I would say that for rural communities, this is only the tip of the iceberg, because the same communities, they are impacted by what we call high livelihood impact diseases. And we are especially, for example, talking of peste des petits ruminants. Peste des petits ruminants devastates the livestock of communities across Africa, Near East, and Asia. It costs about $2 billion a year in losses for these communities. It is devastating the livelihood. It means it has also an impact on food security and therefore on health, and especially on health and nutrition of those children who are highly dependent on milk and dairy products. So this is very important for them. Of course, all of this being exacerbated by the impact of climate change. And what we see is that we see, of course, increased competition over access to natural resources, such as water, pasture. And what is clear also is that even the outbreaks of these diseases can trigger conflict, as communities will try to sort of restock by sometime raiding other communities. So really with host communities and pastoralist communities being really severely impacted by that. Now this leads to conflict. Conflict means that we are losing, that these communities are losing livestock, that this is, of course, leading to displacement of people, often with their livestock, therefore contributing to transboundary movement of diseases. This is destroying infrastructure, this is destroying the health system, therefore the capacity to make the surveillance that we need to indeed monitor the spread of such disease is at risk. And of course also leading to, I said, movement, but also sometimes non-traditional movement of livestock and pastoralists, and therefore leading again to other risk of conflict. So this means that indeed, when it comes to animal health, and therefore going towards human health in different impact, conflict can have huge impact. But in the meantime, what we see is that animal health can be a pathway for peace. Because at the end of the day, what we see is that all those communities who are highly dependent on livestock for their livelihood, this is what they have in common. I mean, even if they have tension among themselves, this is what they have in common. And we see plenty examples in our programs across the world, especially in Africa. And there is an excellent example, for example, of the work that is being done by Interpeace in the Mandera Triangle in Kenya, where, I mean, communities can come, sit and discuss around a common interest that is the health of their animals, which is their wealth. So they discuss that, and what we see is that this is a very interesting entry point for peace. So the point here is to say health, animal health towards human health is heavily impacted by conflict, but in the meantime, health is definitely part of the solution. Thank you.
Thanks, Dominique, and also for citing the example in Kenya. And I think ça rejoint, as we say in French, it connects to what Asi was saying in terms of the, for example, animal welfare being an entry point to bring communities who normally would not sit together to talk about other things, which then is a trigger to start building trust among communities. And we also saw in this example in Kenya, in the Mandera County, which is at the border of Somalia, Ethiopia, and Kenya, is for the first time in 40 years, women have actually been able to have access to maternal clinics just down the road, because for once, people had enough trust between them to actually cross the road. And this is an area that was known as the Death Valley for so many years. So it's small things like that that can actually become triggers for peace and a more holistic society, as Asi was saying earlier on. Just speaking of examples, I want to maybe cite another example as well to illustrate this point of, I think maybe of the systems and how it's not for lack of wanting to collaborate. We collaborate with a lot of partners, even with ICRC as well. But it's also more at the level of the systemic challenge, you know, the way the systems are set up, the way to operate, but also in order to fund the various initiatives from different organizations to fulfill their mission. Interpeace and WHO, in the course of last year, before the full-scale invasion in Ukraine, had actually developed a project similar along the lines that we're talking about, using health as an entry point to strengthen the social contract and trust between state and citizens. And we developed this proposal. We had a lot of stakeholders on board, and we went and approached the international community to fund this really exciting project. We approached 17 donors, and not one of them was able to say, actually, we can't really fund it for the following reason, because peace building, well, that's funded in this bucket. Humanitarian action, that's another instrument. We really can't mix that. Health, oh my gosh, don't get me started. That's with the ministry. That's not even, you know, among us. We can't even deal with that. So it's not for lack of collaboration, but it's really looking at the system as well and how it's set up. So with that, maybe I can turn to Minister Majot to tell us a little bit again about your experience in Afghanistan and the role of the international community in relation to the national governments and the health systems as well. What should we be doing differently after, for example, the example of Ukraine that I just mentioned, or your own experience, of course?
Thank you. Afghanistan has been a unique example from different perspectives, but when it comes, it is engagement with donors. We have two interesting phases. First, started in 2001, in which there was a collaboration of not only focusing on emergency and development, but establishing a political institution in the government. And the second, which starts from the August 15th, where the donor community is stuck in a corner where they don't have any option but to work with a de facto structure there on the ground just for the sake of humanity and ensuring they get the chance to save lives on the ground. But when we look back to 20 years ago, the way the international community and the donors interacted, and then the example we have post August 15th, I have two specific words to share. First, I would like to thank and appreciate all our international partners and donors, specifically those working in the health sector, and more specifically, their staff members as individuals. Their bravery, their commitment, and their drive to help Afghans is highly appreciated. On the other side, the message I have for the institutions is that there is a long way for them and for us to learn and to practice what we talk about in events, in meetings, and in press conferences. I know it is a strange statement because those working in fancy buildings in big cities, in beautiful offices, they don't expect someone coming from a third world country telling them that my practical experience, which have grown with you for 2 decades, at different phases of emergency, stabilization, and development, and then again post-August 15th, which I don't know what to name, and I'm a bit surprised that the new health project is again after 20 years called the Health Emergency Response, and I'm to be honest, I'm a bit confused about it. To tell them that no, the practical footprint you put in Afghanistan tells us and you that there is a great amount of data provided as lesson learned that teaches us. If we believe in efficiency, if we believe in coordination, if we believe in the host nation-led initiatives, we have to modify our approach. What I recommend, the message I share with the international donors is that the time you enter a geography, please start with the end in mind. Please think of the day you will transit the responsibility to the poor government, the poor institution, the poor nation that will have to take on the initiative. The cost, which they will not be able to bear it. The technical capacity that it will not have been developed there in the institutions. And the connectedness. The reason I focus on this one, in the way in the emergency phase, the government institutions are being replaced by donors in technical agencies is painful. We're talking about peace. In the fundamental aspects of a peace process is enriching and supporting the social contract. And I call on experts, do we have a more determinant and effective factor in strengthening the trust in the community, the social contract, than health? So when you replace the health institution, when you question the stewardship and leadership role, what value have we left in that opportunity? We have not added anything. In Afghanistan context, it is proven. The successes we have, I always repeat, it is a result of a joint collaboration with our donors, in which I appreciate it. We have failures, but we have great achievements as well. During the worst days of conflict, the health sector, institutions, and personnel was the only entry point to infiltrate to those communities which were inaccessible for decades. At the days of the regime, when the politicians left the people, when the politicians left the country, this was the health system, given it is role in social contract, given it is trust in the society, it is legitimacy, it is connectedness to society, who remained with people, who assured people, which there is still people who will take care of them. We have to realize this aspects of the health sector. We have to learn from the footprint we have left in countries like Afghanistan and today in Ukraine. Why are you repeating things in every part of the geography? Why should we pay after and after for the failures we make? I believe that the resources are limited, the time is limited, and life's value. And this is the best opportunity to join forces, to avoid from single-mindedness of only technical approach to health. This is the time to engage leadership in peace efforts along with health initiatives. The critique I have always had in our meetings with WHO, that health leaders, health sector leaders, are not equipped with the means to enable them to play the potential role they can have in peace-building processes in their country and in their contexts. I'm sure that the events of this nature can facilitate, can open minds and eyes on the aspect which is unread, the potential which is untapped during last years or decades. The last but not the least, I believe that if we do not look back at the experiences we have left in those countries like Afghanistan, the next generation will be a lost generation, and we as public health experts will be blamed for the failures we're making today, and those whom are experts or actives in health and peace sector and peace initiatives, they will not be spared. This is the time to join forces, to make sure that we stick to the values and dig into the opportunities we have to synergize our efforts and initiatives. I thank you.
Thank you, Minister. If I can look very briefly at Dominique and Michaela. I know the time is running out almost, but a 1-minute flash response, if I may ask. Just building on what the Minister was saying in terms of, okay, there are areas where we successfully collaborate, but there are areas that are just very hard. And why is that? And maybe can we overcome that if it's possible or not? And if it's not, maybe that's okay as well. What are your thoughts on that? Michaela, do you want to?
Thanks. Yeah, it's true. There are areas that are quite straightforward. There are others that are not necessarily that straightforward. And again, the ICRC is not a peace-building organization. But it's true that when designing health, we don't have necessarily the entry point of peace. We have the entry point of the health needs. And the program is designed in such a way that responds to those needs with the content sensitivity that enables to do no harm. That doesn't mean that consequently to that very conflict sensitivity environment and understanding, we could have an effect or we could be influencing peace. And there is where the added value comes. There are others that will work on peace building. We might, with our health activities, contribute to it. And I think that again, it's a combination of actions that will benefit, obviously, institutions and populations. The harder part of it, and I think that alluding a little bit to my first question, is when we partner, we tend to work in parallel and not in complementarity. And I think that this has been mentioned by all the panelists. There is a feeling of not being able to really come up with a unique approach that will be serving that specific population. It's generally institutions that come with their agenda to serve one need and another need, and not necessarily looking at it in a holistic way. Today, let's not fool ourselves. Emergencies have a big role, but protracted crises have been taking much more time and much more space. And the emergency response is not going to be enough. We need to try to work together in such a way that we go inside, or at least support systems and not support moments where the system is not able to cope.
Dominique, do you want to add something?
Well, little to add, but just to say that for us, of course, it's very important to help rebuild the social contract that was referred to by previous speakers, by enabling this proximity that authorities need to have with the local communities, which is absolutely fundamental in the case, for example, of animal health, for the surveillance of disease outbreak, because at the end of the day, I mean, what we are looking at, and very much in line with what El Hajji said, I mean, we need to go towards prevention, anticipatory action, early warning as the best solution to prevent disease outbreaks, to therefore prevent tension and conflict, but also use, I mean, issues of methodologies of conflict sensitivity, making sure that it is really that that it is within the communities that they are not only focused, I would say, relatively narrowly on health issues, but that they have this conflict sensitivity in the back of their mind while, of course, working on health issue, contribute to mitigate the risk of conflict and even promote peace among the communities. For us, this is absolutely critical and needs to be promoted.
Thanks, Dominique. I see you have the last question from me. To build on what the last interventions regarding the getting away from the reacting mode, the reaction, and anticipating more, preparing more. We talk a lot about it, but as you mentioned earlier, we seem to fail to remember what we learned the last time. Why do you think that is? What are we forgetting? What are we doing wrong? Or how can we change that? I know there's not a simple answer to this, but some of your thoughts, please.
Yeah. There's no simple answer, but there are definitely things, that we can do and then we must do. First of all, I think we need to tear down the walls and then the silos. And when we approach, these issues. Because communities where we intervene and then we serve do not put things, in the silos, the way we put it. And it is not rare that you come into an outbreak in a given community where you see what we call a resistance or a denial of the community, which is not a resistance or denial, it's a lack of understanding. Because they ask us indirectly, where were you, when we did not have access to water? Where were you when our children were dying of diarrhea? Where were you when women were dying, while giving birth? But now you are coming with your Ebola, to come, with our, I don't know how many 4x4s, millions of dollars, in treatment centers, and the like. Well, there is something to learn there and then something to correct. And we need to do that. We can definitely also look into if health is a component of every emergency intervention, then we can also tear down the silos there to say that it doesn't matter what type of interventions that we have, what type of resources we have, we pay attention, to the health component, of that. If we have an outbreak and a disease outbreak, it reveals a multidimensional issue, and that multidimensional issue can only be approached and responded to in a multisectoral way. Procurement and supply management on the one hand, access to communities on the other, building the trust, so that, when you have the commodities, people will come in. And it goes on, and not one single party alone can do that. What we can also do is that we should not leave anybody off the hook all the governments, here, frankly, have a responsibility. I hear a lot talk about the donors, rightly so. But I'm saying all governments, they should invest, in the right places. Governments should govern. Governance is responding to the needs of the people. But of course, if the communities will only see the government, to send the police, or the army, where there is a problem, but not, sending the doctors or the water engineers or the nurses, of course, the trust, will be eroded. So many governments, rich and poor, have made a commitment here in Geneva and in some other places to devote a great percentage of their national budget to health. How many have respected that? But very few. Many promises made, many promises broken, and of course, you will not have the required trust, that is required. For the donors, that have, in addition, to their responsibility towards their own citizens, a responsibility also globally, to understand that a geopolitical, geostrategic location of a conflict, of a disaster, should not determine the level of support, or should not determine the level of engagement. All conflicts, everywhere, all disasters everywhere, deserve, the same, type of attention, the same type of support. All refugees and displaced people everywhere deserve, the same. And I think that is only in that sense of solidarity, that we will be strengthening the partnership that is required. If not, there will be a disillusion, in the global solidarity. There will be disillusion because of inequities that are growing. There will be disillusion because of all the other silos that we are putting. And if we don't achieve that, or we reduce those gaps and disparities, we will not get into the peace, stability, and the health in the spirit of complete state of well-being for all, in the spirit of One Health, in the spirit of respect of the environment, in the spirit of saving lives and alleviating human suffering that could apply both to health and peace at the same time. And there we have a journey to travel, and that's definitely something we can do, and then we must strengthen our partnerships in achieving that.
We do have only 1 minute left, so maybe just a couple of very concise and succinct words to be able to wrap this up. Very succinct.
Asi has made my job very easy, actually, because he summed it up really well. But if I had to just sum it up in 1 minute, not even half a minute, essentially, if I had to summarize, there's not a magic recipe. That's the reality of it. However, there are principles and values, I think, that are at the core of tackling this complex issue. We've mentioned it, taking down the walls, accountability of governments and the international community as well, building on strong partnerships that go beyond, as Michaela said, the one-shot approach, and making sure that nous sommes solidaires, there is solidarity among the various actors that are on the ground. So voilà, I won't take much of your time. I know we are right on time to wrap up. So thank you very much to all the participants online, but also here in Geneva, and the Geneva Health Forum, of course.
Thank you, René, and thank you to the participants for such a stimulating discussion.